Good afternoon, everybody. You're here for the New York State Runaway Intervention Program. This will go for an hour. We have David Mann from the Buffalo Police Department and Cindy Neff from our own DC Jazz. I'll let them do their introductions and I'll just get out of the way.
First of all, can everybody hear me without the microphone?
Yes.
We have to use it because of recording. So then I have to try to use my inside voice and not speak so loud when I have a microphone. I remember that. Well, thanks for being here, everybody. I am Cindy Neff. I'm the manager of the New York State Missing Persons Clearinghouse, which is at the Division of Criminal Justice Services. And I'm super happy to have Lieutenant David Mann here with us today, who runs the Buffalo Police Department Special Victims Unit. And in just a few minutes, he's going to be explaining just how great a partnership we have with them. But to begin with, I want to tell you we're here to talk about the Runaway Intervention Program. It's a program we started last year. We had our kickoff in September. So why are we here talking about this? Let me ask. Is there anybody here who's good at GTS? Anybody know what GTS is? Google that shit. Anybody here good and really fast at Googling? I need one person to volunteer to Google something real quick for me. Any volunteers? One person. There we go. Can you please Google how many kids go missing in the U.S. each year? How many kids go missing each year in the United States? Does anybody, while she's Googling that, while she's GTSing that, does anybody have any guess? How many in the country go missing each year? Any guesses? Wild speculation.
50,000.
20,000? No. No. All right, do we have our GTS? What is it?
800,000.
800,000 children. Fake news. So sometimes you cannot trust GTS because when I tell you last year in New York State, we had 12,623 children reported missing. Actually, it's missing child reports. Does it make you think that there was 12,000 missing children? No, because what we have is children who have repeat missing episodes. So let me share some numbers with you on this. Last year, 12,623 reports of missing children, but actually 6,215, about half, right, who only had one missing episode. So the rest, 6,408 of those missing person reports were actually repeat missing episodes for 1,835 children. So 1,835 children. When we first started looking at this a couple of years ago, I was like, all right, if you start to think about 12,000 missing kids, how can we help them prevent going missing, those children from going missing? It seems like an overwhelming task thinking about 12,000 children, but it's not really 12,000 children. If you think about 1,800 kids who are having repeat missing episodes, it seems more manageable. What can we do to prevent them? Because 98% of those missing child reports that we got in New York State are reported as runaways. So that's why we're here today to talk about prevention of children running away for those 1,800 children. So last year we put together our Runaway Intervention Program. So for these kids who have these episodes of running, what are the consequences? As you can imagine, there's probably some pretty bad consequences. Family instability. Obviously, there's a push-pull factor going on with children when they're leaving their home or wherever they reside. We know that there's a lot of children who are in the care of social services, who are in foster homes or residential facilities who go missing multiple times, and children from their own home. But what's going on there? What kind of conflict is happening in that home? socio-emotional health, they're more likely to be depressed, have suicidal thoughts, different things going on as far as substance abuse, things like that. Poor sexual health, are kids having survival sex when they're out on the streets? Are they being exploited? What's going on there? What about STDs? All things to consider that's happening with the kids. Pregnancy. Poor educational outcome. Now I told you that about 50%, a little higher, of kids in New York State have multiple missing episodes. We had one child last year who was reported missing 59 times in 1 year. How can he be successful academically? What's going on with him? So the more episodes that children have where they're running away from home, the less likely they are to be successful academically. And then they also have an increased risk of being involved in the criminal justice system, and that's something we're trying to avoid, right? So here's some interesting facts that a youth who runs away multiple times, they're 18% more likely to drop out of high school. For children who one time run away and is homeless while they run away, are 26% more likely to drop out of high school. And finally, repeated runaways, homeless episodes are 35% more likely to drop out. So why do we care about that if they're dropping out? Is it a big deal? Doesn't most of your basic employment at least require a high school diploma at a minimum? So we talked about repeat runaways, 35% more likely to drop out of high school. Did you know that juvenile incarcerations are 13% more likely to drop out? So we talked about they're going to have a higher risk of being involved in the criminal justice system. That puts them at a 13% higher risk of dropping out of high school. And 75% of the crimes committed in the United States are committed by people who have no high school diploma. So that's when the bells and whistles are going off in my head and saying, we need to do something. We need to help put a program in place where everybody's working together to help prevent these children from running in the first place. So let me show you out of our canceled records. So when a missing child is located, by state law, the police department has to report to us at DCJS how that child's case was resolved. And the way we made this easy for them to do it is when they cancel the record in the state and NCIC database, they have a list of choices to choose from for the reason that they're canceling it. So that's what I'm showing you here today. These are our cancel reasons from last year. Now you can see that we had 458 children who were arrested when they were located. We had 93 children who were victimized of some type of exploitation while they were missing. And some who were arrested and victimized, that was 29. Now I want to also say that this is at the time the missing person record is canceled. So do you think after that, if they're having a conversation with the child, they could have been victimized and they didn't know it when they canceled the record? So I suspect if there was a serious follow-up on that type of data, you would see much higher numbers there for the exploitation. And then tragically, we had 11 young people who were located deceased last year. These are the 11. Do you see a common occurrence for these? Under the circumstances, what were they entered as when they first went into the system? They were all considered runaways. So I know it's hard sometimes, especially for the police, when you're getting 59 times this kid has been reported missing to your department, or 35 times, or this is her 10th time, right? You're short-staffed, it's a lot of work to go out and try to locate these kids, and you're bringing them back. Some of them is the revolving door at the residential facility where you're bringing them back, and then before you're out of the parking lot, they're going out the back door. I get that. That's frustrating for everyone. And that's why we're all working together on our runaway intervention program. So you can see all listed as runaways. Now, some accidental drowning, honestly, they should never have been entered as a runaway because they knew that those boys went swimming and they drowned. So they were missing, but they weren't really runaways. So that's bad data. That's people not making the entries correctly. But then we had a couple homicide victims, and that was very unfortunate. And they were runaways. And they're just in the wrong place at the wrong time. That can happen. And then we had suicides. You know, our young people are at a higher risk of suicides now when they go missing. We're having increased reports of that. So any missing child should be considered endangered until you can rule out any other reason. Okay, that's why I really emphasize that. I know it can be hard when you get these missing person reports, especially the 10th, 11th time, but that can happen. So we all need to take it seriously. So here's our Runaway Intervention Program, RIPSTOP. It's Services, Training, Opportunity, and Prevention. And our mission is to develop a system where we can all work together to help these kids and provide them the services and resources that they need and that they deserve. What I was seeing in my years at the Missing Person Clearinghouse is a lot of finger pointing when kids are going missing, especially repeatedly. And my goal of this program is to get everybody to work together. Let's break down those silos. Let's have law enforcement, social services, and all the resources that these kids need together in the room, coming up with a plan. Let's look at the barriers that are preventing us from helping these kids and take a serious look at it and see what we can do. These are the members of our working group, and you can see we have a lot of people on this committee, right? But we're so happy to have them working with us, especially the Buffalo Child Advocacy Center, the Buffalo Police Department, we have NECMEC and some other nonprofits, a lot of state agencies. We've broken it down into 3 subcommittees. The first one is on best practices. So they're looking at developing best practices and guides for parents, what to do when your child leaves home, how to have a supportive return for that child, and then they're going to be looking at best practices for social service agencies also. We also have our legislative subcommittee. What kind of laws could be preventing law enforcement from finding a child? Do we need to make recommendations to modify laws or to create new laws? Are there laws that's causing social services, preventing them from sharing information with law enforcement when a child is reported missing? So that's the kind of things that they're looking at. And then we have our RIPSTOP pilot program. So this is a multidisciplinary team approach. This was the idea, actually, it's formulated after Project Harmony, which is out in Omaha, Nebraska. And I give Dave all the credit for this because we were talking one day and I had been researching like other runaway prevention programs and I was reading about Project Harmony. Dave and I were having a phone call and he was telling me he had actually been talking to them out at Project Harmony. And we started talking about it. We all went out there last year actually and met them, toured their campus, and this program that we're starting in Buffalo is modeled after it. So 2 main components. At the Project Harmony program in Omaha, the Omaha PD is co-located within the Child Advocacy Center. And any child who is reported as a missing child or a runaway, who is not already system involved, gets referred to the Child Advocacy Center Runaway Intervention Program there. And that child, when they return, they immediately start working with the family. And when the child returns, the child gets a physical exam, they get the therapy they need, there's family counseling, there's all kinds of services that they're providing these kids, and it's been pretty successful. So that's what we're trying to do in New York. We wanted to have a pilot program that could be used, if it's successful, throughout the state. And Buffalo PD has agreed to be the pilot program with their Child Advocacy Center out there. Dave has so many good ideas about this. I can't tell you how much I appreciate the thought and effort that he's been putting into his cases out there. And just to give you an example, like I could show you these statewide statistics all day long. One thing that he's done, he drills down on those things even further. And for an example, if he has a missing child case, he might look at, I wonder how many 911 calls came from that child's house. I wonder how many times this child's name has been listed in a domestic violence report. So he's looking not just at this kid has run away, what do we need to do to find them and get them back home again? He's looking more broadly at what's going on in that child's life. This is their new Child Advocacy Center. They just opened it this week. I'm really happy that we're going to be out there next week actually doing a different program called our Missing Child Rescue Operation, where we have experts from across the country coming in to help them work on missing child cases. I'm very excited about it. Hopefully it'll be a success and we'll be able to do more throughout the state. So this is their new building. And that's it. That's all I have. I'm going to turn it over because I really want Dave to be able to explain to you what they're doing out there in Buffalo, how that's going, and how this is going to work with our pilot program.
I can still talk because of the air conditioning. Is anyone else freezing? Oh, and the sign isn't up yet. So our new Child Advocacy Center is opening this week, as she said. And that's a huge project and a huge advantage for us. As Cindy said, I run the Special Victims Unit for the Buffalo Police Department. We do investigations of sexual assault, domestic violence, child abuse, elder abuse, missing persons, sex offender registration. We have the juvenile function, and lately more and more internet crimes against children, some of which come from the state police, and some of which come from our own patrol reports. So I'll start to tell the story kind of all over again, but coming at it from a different angle. So, as I said, we do missing persons investigations as part of a unit that's responsible for a lot of different investigations, and we're a high volume unit. I think last week we passed like 1,600 files in the office so far this year. In the middle of that are the missing persons cases, and most of those end up being runaways, as Cindy said. And they can range anywhere from, age 11, I think, is the youngest one that we've had as a runaway so far this year. But they can go anywhere from there up to 18. And they can continue for weeks or sometimes months or years. Over the last 3 or 4 years, probably since 2020, I noticed that we were getting more and more reports, and that those reports were eating more and more staff time. So I first started to look at this as a staff time problem. So the expectations within the community about what the police response would or should be seem to change over the years, and the volume was just going up. And I think, Cindy will back me up on this, I think we almost doubled over the last couple of years. And did I do something? We almost doubled over the last couple of years, and we're threatening to do that again this year with missing persons cases in general, and then those cases under the age of 18. I think we were north of 500 cases last year. So I never looked at it, broadly before as an issue, because our role in them is pretty direct and to the point. If a kid's missing, we're to find them and then return them to the responsible parent. And really, that's it. So it wasn't the kind of issue that I looked at in any depth. In order to understand why the numbers were going up and why they were eating so much investigative time, in other words, we were losing whole days where I'd have 4 or 5 detectives working on a single case instead of whatever their day was scheduled to be, because we were uncertain about the condition of the kid or the circumstances of the disappearance, or the someone 12 or under. So I was trying to understand the volume, and I went to our crime analysis center. Kevin Skellinger has been there for a number of years, and I've worked with them on a number of different projects. And I'm non-technical, so I speak plain English, and he knows generally what I'm looking for, so he was able to turn it around fairly quickly. And once I looked at the numbers, I realized that it wasn't just my impression, that our numbers were up and continuing to increase. So I asked him to relook at the cases again, and this time, because first he just did it by the incident number, the CV number. So I said, do it by name, just give me the missing persons under 18, and give me any multiples, so make sure they're grouped together if a single person was in there multiple times. So then I understood the problem about twice as well, because once I saw it laid out, I realized that there were a small number of kids who were reported a large number of times. Their missing incidents tended to be longer, and they were also disproportionately kids of color. So then I had him take the same names and run them. All this is just in our report system. This wasn't like reaching out to Child Protective Services or any other system. This was just in our incident report system. So I had him look at any kid that was reported missing first. I think I did 3 years first and then 5 years. And I said, give me any other report that they were mentioned in and just the general nature of the report. And it was, I guess, kind of as we should have expected. A lot of domestics, a lot of the kids had been named earlier, previously in years past in a law enforcement referral, so some kind of abuse case. And as the kids got older, more and more incursions into the criminal justice system. And we also found things like, we had one kid who was reported 28 times in a month. And it was because she was late every day returning to a program. So she was in a residential program, and someone must have told their worker, oh, you need to report to the police. So the report would come in and usually resolve within a couple of hours, obviously. But we found things like that, so I guess we would call those system problems. So it's interesting, Mark Wynn there, the keynote, I must have heard him like 1997, so almost 30 years, but I've been in charge of our unit since 95 and 38 years in the police department. So a lot of what he was saying around domestic violence, it was going on, from 94 on, and, I've sort of been raised in this coordinated community response idea or model. In other words, things will go better if we're working together. How many of you are familiar with child advocacy centers? Okay, most people. So that's, we do joint investigations with Child Protective Services and the District Attorney's Office on child sexual abuse and physical abuse cases, and those play out at advocacy centers. Our state is now proud to say we have one in every county. And around domestic violence in our county, we have a family justice center that was established, I think, in 2006. So it's a way that our department is familiar with working in. So when I was confronted with the numbers, all I did was I went into Google and put in, I think, like adolescent, runaway, missing, teens, program, community-based, probably search terms like that. And the first program that came up, as Cindy mentioned, was Project Harmony. Now, I've been told about Project Harmony in Omaha, Nebraska before, because we were, at that time, a couple of years ago, in the process of working on the plans to build a new advocacy center for our county. So I was asking around, if I was at a conference like this, I would say, oh, who should I look at if I was looking at a state-of-the-art child advocacy center in, today? And repeatedly I was told Project Harmony. And Cindy can attest to, we went out there, oh, they have a campus, 3 buildings. And Omaha's not entirely dissimilar from Buffalo. The only thing that they have Warren Buffett though. So they had a lot of money that was donated to build the center. But having said that, the facility was beautiful, and the program that they have is very integrated into other kinds of problems that kids run into. So I called out there and said, hi, I'm from Buffalo and I'm looking to copy your program, and got some information about it. And then separately, Cindy and I were working on stuff on ways that we could improve our response to missing kids in Buffalo, and we had the conversation that you already referenced. So this is a sort of separate effort. I've been working with our community foundation, they have all the money, on ways to keep kids, particularly kids of color, out of the juvenile justice system. So we were sort of looking at that in 2 ways. One was the formal diversion system that all kids run into when they end up in the custody of the juvenile justice system, and then this sort of amorphous idea that we had about what would pre-arrest diversion look like. So when I looked at what Project Harmony was doing, and I had already looked at the kids who were running away, particularly the older ones, and their incursion into the juvenile justice system, it felt like a good fit. So I went to the community foundation and I said, I want to do this thing, I want to imitate this program in Omaha. And at that point I was just trying to get us out there to look at it. And they were willing to work with us on that, and ultimately the state took care of it. Yeah. Thank you, New York State. Thank you, Department of Criminal Justice Services. But they've funded a pilot program for 2 years. So we have an MOU, which is got signed last week. And we are going to work with our advocacy center in Erie County to improve our response. Some of it will help us address the manpower issue that I talked about first. So we'll do our normal intake, we'll take the report, we'll investigate and look for the kids in any locations that we have. But many of you who've done this work, a lot of times the parents have little or no information for us about where the kid might be. They're not really in touch with what's going on in their kids' lives in many instances, so we don't have a lot of information to go look at it in the first instance. In a lot of instances, the kids run because they're being punished for something else, and when they get punished, the first thing a parent does is take away their phone, and that's the thing we usually use nowadays to find people. So we don't have the phone to ping under those circumstances, so we have to do it the old-fashioned way. Our thought and our process is going to be this: we'll do our normal intake, we'll look for the kids, and then we'll do a referral for the parent or responsible adult to the Child Advocacy Center. While the kid is still missing, they'll do an assessment with the parent, find out from the parent's point of view what's been going on, work with the parent to generate any other information they might have, friends that we might be able to check with, trusted relatives that the kid might go to, and so forth. If any of the information they gather will help us find the kid, that'll be funneled back to us. But otherwise, they'll work with the parent about what's been going on and about what might help stabilize things once the child's returned. When we locate the child will have an assessment, little a, with the Child Advocacy Center, find out if anything bad happened when they were on the streets. And for us, this is a big addition. This is something that we weren't doing before. We were treating runaway instances as one-offs. We weren't really thinking about continuity or anything beyond our role of locating the kids. So our hope is to generate some kind of history but a history that'll be confidential. It will reside with our Child Advocacy Center, so that in future instances, we might be able to draw upon that previous relationship to help us in any future running events. But our goal is to improve the quality of the kids returned to the household, provide the parent or responsible adult with whatever support they need so that the kid won't be as apt to run away, develop safety plans with the kid. Is there another place that they'll agree to go to, that the parent will agree is a safe place, so that if the kid feels like they have to leave the house at any future point, that they'll go to a pre-designated place, let the parent know that that's where they're going, and have a plan in place for them to continue with school, return, and to work together to try to address the problem. So that in a nutshell is the model that we're working on. Our hope is to cut down on the number of running incidents and to try to work with community partners to address whatever the underlying circumstances are, particularly with the younger kids, before the situations get more and more complicated, so that we'll have fewer running instances going forward, and to have a decent system in place so that when kids are located, that we do a better job about finding out what was going on while they were outside of care, and be better able to address these. The last bit is we've got a lot of resources in our community, and our hope is to work with the Child Advocacy Center to build a community-based response to this, because really, other than our limited role of going out and finding them, we have very little in the way of experience and resources. We, the police, are talking about. In terms of being able to work with the kids under these circumstances sufficiently to improve the underlying situation, so our hope is by working with everyone that we'll have a better response to it. Cindy, do you have?
Can you give them like a general example? I know we haven't actually started the program yet, but you have referred
We have,
a couple kids.
yeah, we had, so we had a kid, 14, who was missing, and I happened through work to know the parent from other circumstances, so their parent reached out to me independent of well, she had actually reached out to me time before that, but chose not to report. She was very concerned that her reporting would have a negative impact on her relationship with the child, and she was also very loath to have her child's information on social media, which a lot of other parents ask us for now that we've been doing that, but she was very reluctant to do that. This situation was sort of atypical in that the parents were very involved in their child's life and very organized, and the child, the 14-year-old, doing well in school, wasn't at that time exhibiting any other kinds of problems, but they were having sort of arguments at home, and then the kid left. Their main concern the second time he ran away was that they knew him to be in the company of other kids in the neighborhood, and those kids were gang involved. So while the kid wasn't gang involved, the kids that he was hiding out with were gang involved, and that was what made them decide to report it to the police. So we had the missing persons report. I refer them in the same way that we were talking about for the pilot. I referred them to the Child Advocacy Center. I called the head of the Advocacy Center and let them know about the circumstances of the case. They worked together on what had been going on, and we're working on a plan for the kid's return. I had a detective assigned to the case, and that detective also went out to the home and talked to the parents. And when the kid returned unexpectedly, the brother found him and talked him into coming home. That detective was on his way home to Hamburg, those of you who was on his way home to Hamburg, which is one of the suburbs, turned around and went back to the house and talked to the kid for about an hour and a half. talk to him about mentoring programs that he was familiar with, let him know that if there was a problem in the future, that he could call the detective directly, and talk to the parents about, the same things, and just being willing to continue to interact with the family if they felt that that's what they needed. So it was, on every level, at least in the moment, a success. The kid continues to have problems. I know that there have been other incidents, so it's not like anything else that we work on. It's not a panacea. But they have that relationship now, both with the detective and with Best Self if they need support. Best Self is like a behavioral health organization, a big one, so they have everything. And it's what we want to build towards in the future. That first of all, that people will trust the police enough to call, because that's been a concern too. People won't come to us, kids can be out in the community for quite a length of time before we're even notified. So we want to build trust within the community. We also want to have an alternative means for them to report kids missing if they won't come to us. So that's one of the things that we're going to build, so at least they're getting help from someone.
And something I forgot to mention too with the pilot program, okay? With the pilot program is we're also partnering with the Youth Justice Institute. So as we move forward with our program, our pilot program for 2 years, YJI is going to be doing a research part of that pilot, so we can measure our successes and get all the data that we're going to need out of the program. So we're very excited about that. This is going to kick off pretty soon. I think the MOU is like
Signed, sealed, and delivered.
finally, yes. They're hiring a program manager at the Child Advocacy Center who's going to administer the program. And I have to give so much credit to BPD and the Child Advocacy Center for partnering with the state on this. It's not always easy to work with the state, I know, because I work for the state. And for them to be open to hearing what our subcommittee, our RIPSTOP pilot program subcommittee has to say, to report back to us on how it's going and take our suggestions about, maybe we should try this or that. Like, they're being totally open about it, and you don't see that very often from other organizations. So I really appreciate that.
Yeah, and to be clear, so we have our program in Buffalo, so we're piloting it in Buffalo to pilot it for the state. So as we get into it and adapt what they're doing in Omaha, we'll take the information back, and it's all 3 entities are on the pilot panel, the pilot committee. Us, the Community Foundation, they're the funder, and Best Self Behavioral Health, which is the parent organization of our Child Advocacy Center. So as we begin to flesh out the actual operations of it, we'll bring what we're doing back to the panel. If we hit a brick wall, we'll bring it to them so they can help us figure out a way around the brick wall. If we're having success with something, then we know that that's probably something that we'll want to bake into the pilot. So as it stands now, we've got funding for this year and next, well, 2 years starting now. And we'll run it for the next couple of years, and then hopefully we'll have a pilot that can be implemented quickly in the rest of the state. No doubt with the generous funding of the Department of Criminal Justice Services. Given the audience here, there's a couple of things I want to say about it. We wouldn't have been able to figure out the nature of the problem if it wasn't for the assistance of the Crime Analysis Center. I've been using them since they came into existence. Being able to, and they're housed in our building, so I can get on the elevator and go to the 3rd floor. And go and sort of in my roundabout way explain the problem I'm trying to figure out. And then I have people who can help me get the data I need to understand the reality of the problem and try to sort it out. And that's in addition just to their day-to-day help in us figuring out and solving our cases. The other person I have to point to is we have a probation officer named July Orlowski, and her caseload is the runaway kids. And part of this idea of collaborating was just the day-to-day collaboration that my detectives have with the probation officer. Because a lot of times they have information about everything else that's been going on with this child that we lack in the initial report. This is one of the things that we're going to try to correct as we go forward, but our experience has been, we'll get a report from the parent or guardian, we'll be working on the case for a few days, and then we find out that CPS has been involved with the kid. So the CPS worker that might have relevant information. And then later on, we might find out that the kid is, involved with a behavioral health organization or is under supervision or probation and so on. So part of what we're going to try to sort out is an organized way for us to have that information up front so that we'll be faster about locating the kid. But a lot of that learning came from, like I said, working collaboratively with probation in general, but particularly with this the probation officer with the caseload, because they often have information that we're lacking. And as kids get older and as kids are more system involved, they're also better able to elude the police trying to locate them. And so we're trying to do a better job about that by working in conjunction with the other community partners.
Thank you. Does anybody have any questions? Yes?
Probation's not part of the pilot?
Probation will be at the table with us, yeah, for sure. And they're part of the pilot at the top, and on the state level, and they will be interviewing us, like I said. We're working with them on our more difficult cases already. So
Is this something to be looking forward to, if it's successful, integrate within our own state agencies that deal with youth that are runaways or things like that, once we juvenile justice and stuff, or is this going to be something separate from kids who are actually in our system?
You're in the States.
I know.
I'm just a dumb local county. I don't know.
Well, I only have 137 more office days and I'm retired. No, only kidding. No, I really am. Well, the goal of our RIPSTOP program is to be able to replicate this in different areas of the state. Now, not every county has a child advocacy center. In some areas of the state, we don't need this type of program. We have counties in New York State that some years they don't even have one missing person reported. So, like, for example, Hamilton County, least populated county in the state, you're not gonna need a program like this. Albany County, yes, we have a lot of residential facilities in Albany County. If you ever look at our annual report, you'll see a very high number of runaways out of Albany County compared to other counties, and even per capita it doesn't make sense, but it's because we have so many residential facilities here, like St. Anne's and LaSalle, and it's not Northeast Parent and Child anymore, but there's what?
Rivers.
Yes, right, Rivers. So we have a lot of those non-secure facilities, and a lot of those kids are not even from Albany. They're coming from all different parts of the state. I know that we've gone over and had meetings at St. Anne's. They have like a huge number of kids who leave from there, and they're trying their best. They do have a representative on our RIPSTOP program, but it's hard because these kids are just from all different places. So then you have to look at that push-pull factor once again for kids in St. Anne's. What is it? Well, if they're from the Bronx or Brooklyn, but somebody put them up here at St. Anne's, where are they going to try to go? They're going to try to go back to their community that they know. St. Anne's is one of the facilities in the state that will take kids that nobody else will take. So once kids start getting those multiple missing episodes, it's hard to get a residential facility to take them in because they know that they're going to be eloping, so, and whatever other issues that they have. So that's some of the considerations, but definitely Albany would be like a perfect place to do this once the pilot, and we use that as our template. But it won't be easy to do it in some other parts of the state because you need all those resources and services that they do have in Buffalo. As Dave was saying, with behavioral health being that massive, whatever you call it, the help, like they have, yes.
Drug treatment,
Yes, they
both
have
adult
all
and
that.
child drug treatment, trauma treatment, it's a huge.
Yeah, so easily for the kids to get the services that they need once those are identified, then they can be referred right within that whole system. So that might be difficult to find that within different counties in New York State, but that's the goal, is to create something that could at least be, put in place easily. Like, here's our template, here's what you need to do. Here's the team, multidisciplinary team members that should be working on this, things like that.
So I'm only responsible for the city of Buffalo. When I looked at the problem, I looked at it a particular way and I was trying to solve that problem. When Cindy and the clearinghouse got us all together around this concept of a statewide approach, there were law enforcement officers from other parts of the state, and their view of what the problem with runaways was different than mine. And a lot of it had to do with small towns where kids are leaving non-secure facilities all the time, wreaking small havoc in the towns, then being repeatedly returned to the facility. That's a different problem than what I'm trying to solve, but it is, if that's the problem in your community, that is part of the larger problem that the panel is looking at. It just, our approach is based on the problem for my jurisdiction.
Yeah, and I think most importantly, this is going to help change attitudes about runaways, about kids who are missing and multiple missing times, and actually get people to start talking to them, listening to what they have to say. Those push-pull factors, it could be something you're not even thinking about. A couple of years ago, I was out in Arizona for a conference, and a woman came up to me who was from Detroit, and she said they had a non-secure facility. The kids were leaving all the time. They just didn't know what to do about it. And finally, they asked the kids, why is everybody leaving? Because there was bed bugs in the facility. So sometimes it's not always that easy, just ask them, okay, now you know something that you can fix. But, in some of these facilities, are the kids being harmed? They're getting beat up or, assaulted, whatever. There could be things that are happening in the facility that's making them leave, or at home. It's so very important to ask, 40% of runaways report that they're being sexually assaulted at home, and 80% of those are girls. So it's important for us to find out the reasons, and I think this kind of process, these referrals, will help get down to the nitty-gritty of what's going on with that child in their life, and what can we do to help them be a successful person and to keep them safe. That's the most important thing.
What does the prevention think of this?
So the goal of the project is, like I said, to build a community-wide network. So that will be part of the solution because we have our defined role. But what we're hoping is the coordinator that'll be out of our Child Advocacy Center will work with the community so that this becomes viewed as a community-based problem. There's been a lot of talk about decreasing police roles in some kinds of problems. This feels to me like one of those problems. We have a distinct role, but I'll tell you, a lot of times it seems like the only expectation is we'll go out and locate them without thinking about what happened before or what comes after. The way we've been talking about it is we want to achieve a point where a kid knows how to be safe if they don't feel like they can stay at home. And that the community recognizes where safe places for kids are. And if we can start with that, then we can always bring whatever other services that they might need, or help or support to that place, as long as they're going to a safe place instead of wherever they end up. So we want to build a community network, but that has to be driven by the community. And we need to spend a lot of time and care to understand what that would look like from their perspective, so that it's something that'll be trusted.
So right now, does the pilot program have an outreach or something, outreach to
Yeah, so that's the,
business?
yes ma'am, so that's the role of the coordinator, is going to be to build that community, broad community network. And the network would be like the ultimate goal, that we would have an organized sort of system around kids who might run or are running. But the beginning part is to understand what the community is looking for from us, and what the expectations are, and also where they see themselves in response to the issues. As we're talking, I can think about the last 10 cases we got, and all 10 cases were different. All the circumstances were different. But all of it, comes from the community to us, and then goes back into the community when we've located the child. So the goal is to reach out to the community, talk about what their expectations are, whether or not they feel safe reporting to the police, whether or not they feel safe with the community programs. A simple example is we were talking about, there was a program on the west side of Buffalo. It was an overnight program. A kid could just go there and hang out. They could get assessment if they wanted it. Yeah, it's called West Side. So we were talking about Club West Side, and it was pointed out by a person in the committee. This was not our state committee, this is a local one. Well, that's great for anybody that lives within 8 blocks of Club West Side, but a kid from the east side or east side of Main Street isn't going to go to Club West Side to find safety, because they're going to feel safe in there. So it's working those kinds of things out. Like, what if we're giving, for instance, if we don't have sensitivity about where we're sending a kid for counseling, or instructing a kid to go for counseling, if we're not sensitive to those kinds of issues, they're probably not going to go. So it's going to run into, and all of what we're talking about is voluntary, by the way. We're not, these aren't kids that are involved with, we're not, probation or a diversion system. So we have to build it in a way that people will accept it, or it's not going to work. So will they accept the call from the Child Advocacy Center? Will they go through the assessment process? Will we have time with the kid once the kid is located? In order to have that be effective, we're going to have to be effective about engagement, and that's going to necessitate interacting with the community so we understand what that would look like.
And they are setting up listening tours. They're setting up listening tours to go out to the community, to the Child Advocacy Center, and get that feedback from them.
Well, what prompted the question is, a lot of times when we experience, I'm out of Orange County with probation, a lot of times when we experience runaways, and then we reach out and we're trying to find them, we encounter a lot of times where different places that the children had been prior to them running away were getting red flags, but no one was doing
Anything about it.
with it. And so eventually the parents who had tried to find the kids on their own for a while, they then go in, because we still deal with, in our area, a lot of the police departments put in the parents on and tell them, oh, you gotta give it 24 hours. Like,
By the way,
And
that
tell them
is
over-
not a thing.
We know,
That is
and we
not
tell
a
the
thing.
parents over and over.
My deputy police commissioner is here, I promise you,
I-
not in our department.
New York State law, you have to take a missing person report, missing child report immediately.
Right.
There's no delay.
Well, telling the parent that and parents getting that service when they go to the local police is not the same thing. The number of times that we get the call and tell them we need that report and we send them, and then there are too many times that they are in the lobby or standing outside saying that they're there, and
And they
they're being
won't.
told that they won't take it.
Yes.
Somebody has to get on the phone and say, listen, you have to take the report. What is the problem? This is a constant. So again, that's why I'm asking about the prevention piece, because a lot of times, like I said, we find that teachers, the gym teacher or the sciences, somebody has noticed. Sometimes even bus drivers notice kids that, you know, they notice on someone else's route, and all of a sudden the kid is walking along and this kind of thing. So that's why I'm asking about the prevention piece, is that going out, because that's a big part of what happens, and that is how these kids end up lost and far away from home and then exploited.
Exactly.
So that was the part I don't think I said it clearly, but that's why we want this history to reside with someone else beside the police department, so that someone is at least tracking from incident to incident. It's been going on in the home. People might not be comfortable telling us. We might not want to create that kind of record within the police department, but we do want to have that history reside somewhere. So if the parents are willing to work with our Child Advocacy Center, then at least they can retain that, and it'll have the usual protection that clinical records would have. But it has, at least has a means to come back to us if it'll help us locate the child. It also can be a means for us, for problems like that, to be brought to our attention while protecting people who don't want to deal with us directly for whatever reason. So we do sometimes get, for instance, anonymous information in the police department about a house where things are going on, and if people are concerned that kids are either given access to drugs or being trafficked or some other kind of problem like that. This would be another conduit for that kind of information to get to us, that people might be more comfortable with, if they're not comfortable with coming to us directly. We would prefer they come to us directly, but if they don't, at least there's some other means.
And we were just given the 1 minute sign, so I wanted to say, I forgot to put my contact information up there on the slide, but just Google us. New York State Missing Persons Clearinghouse, that won't be fake news. It's 800-346-3543. We have staff on call to help you with any of your missing person cases, anything you need. And when we get calls from families who are having a hard time with police, we will reference the law, we'll send it to them, go into the precinct, go into the police department, show them this is the law, they have to take the report. So thank you all for being here today, and you did a great job. Pretty much everybody stayed awake. I really appreciate that. It's not easy after lunch, so thank you.
Thank you very much.